Thanks so much for joining us for another edition of our Open Mic program. And we do have Stephen Webb with us. He's with White River Health. And I'm telling you, this has been one of the biggest stories that has really hit Arkansas in a long time. But it's really not just dealing with you, but it's been hospitals nationwide.
Yeah, it's been nationwide, and we've seen it a lot here in Arkansas. And it's not a conversation, Bob, that I really want to have with you because things didn't work out the way that we wanted them to work out. But there has been some changes with our relationship with UnitedHealthcare.
You know, as we've had on the news already, that UnitedHealthcare, let's talk about what happened.
Yeah, we have tried to negotiate with UnitedHealthcare for several months. And as of April 1st, White River Health hospitals and facilities are out of network with UnitedHealthcare for commercial and Medicare Advantage plans. This means patients with UnitedHealthcare coverage may have changes in their benefits that makes them pay a little bit higher out of pocket. We want to continue to serve patients here, and our physicians' offices are not impacted, and they remain in network for the time being.
Now, one thing we need to say, you can always contact your insurance, your health insurance agent, because there is some that can move. There is always ask.
Correct. So it depends on what kind of insurance you have. Medicare Advantage plans, you may have the opportunity to be able to move through April the 30th. To other in-network providers, and we got that information on our website. And then if you have insurance through your employer, you can talk to your employer about what out-of-network benefits may exist. And there are also continuity of care waivers that you can get by calling the number on the back of your insurance card. So if you're pregnant, have a chronic condition, or have care that you're going right now, you can be able to get a continuation of that care. The downside is White River doesn't make that determination. UnitedHealthcare makes that final determination on whether that care can be continued or not. But there may be some out-of-pocket benefits that you can qualify by calling the number on the back of your insurance card.
A lot of people want to know, why did this happen?
White River Health entered into negotiations to secure a new agreement with UnitedHealthcare that would reduce denials, improve access for patient, and better support the sustainability of our health system. Unfortunately, UnitedHealthcare's proposal consistently fell short of what it took for us to preserve the quality of care and access points that our patients deserve.
When you look at this, what does this mean for patients with United? What does that mean?
It means that they may have different out-of-pocket costs. If they have an emergency, those are in-network services, and they can continue to come to our hospital. And you just need to call the number on the back of your insurance card and see what your coverage options are, or visit one of your local trusted insurance brokers to see if there's an opportunity for you to change.
Now, when you look at that, what is some of the health plans that are affected?
It is all of our commercial insurance with United, whether that's through your employer or you've purchased that individually, and it is our United Medicare Advantage plans.
Now, what are some of the options do patients have to continue care at White River Health?
Well, one thing I want to make sure that everyone understands is retired teachers, retired state employees, and VA members can continue their care here with no change. If you have Medicare Advantage, you can call a local insurance agency to see if there's an opportunity for you to change. And then, like I said before, if you got your insurance through your employer, reach out to your HR representative, or if you have your own that you've purchased, go to see your insurance agent or call the number on the back of your card to see what your out-of-network options are.
Now, what should patients do in case of emergency?
Emergencies are covered in network. So if you have an emergency, come to the emergency department, call 911, or go to your closest emergency room.
And then what can patients go to get more information? I mean, that's something that we know to go to their own insurance agent, right? But there's other information just to be getting themselves educated.
We have a call center, and you can call that number at 870-262-3777, or you can visit our website, whiteriverhealth.org/UHC, or call our patient support team at 870-262-3777 for the latest information. And there's answers and frequently asked questions there.
We appreciate you taking this time. I know it's been a difficult week for White River Health, but the staff and everybody in the community is showing such support that I think this is just one of those bumps in the road. It's going to make it better for everyone.
Well, thank you. And we pride ourselves on delivering high-quality patient care here. And we were recognized earlier this year as a Forbes Top 100 hospital, one of 4 hospitals in the state, solely based on our outcomes. And we want to continue to provide the highest level of quality care for the patients in this community and all the communities we serve.
We've been talking with Stephen Webb. He's the administrator of White River Health. And Stephen, thanks for taking time and talking to me like always.
Thanks, Bob. Appreciate you.